Good morning, everyone. I am both pleased and proud to be here today as a representative of Amgen, which is a co-sponsor of this wonderful event. I was trying to think of what I was going to say this morning, and given that my CEO is going to be following me and when I read his remarks, realized he had stolen all of my thunder, I'll just try to speak from just a personal perspective. Now, Amgen is really one of the companies that helped launch the biotech ecosystem in LA going back to 1980, when a group of faculty at Caltech, like Norman Davidson, Leroy Hood, at UC Santa Barbara, John Carbon, and at UCLA, Winston Salzer, got together thinking that they could apply this newly emerging science of recombinant DNA technology to develop a whole new class of therapeutics. And they came together to launch Amgen, Applied Molecular Genetics. But critical to that was a UCLA graduate student. His name was Philip Whitcomb, got his PhD from the Molecular Biology Institute in the mid-1970s. And he went on to get an MBA at Wharton. Then he went on to Abbott. And at Abbott, his boss was George Rathman. And one day, Philip gets a call from his ex-PhD advisor, Winston Salzer, who was asking, I'm thinking of starting this company. And, but the investors say I need somebody from industry who knows about, how to develop drugs, but I don't know anybody in industry. Do you know anybody? And of course, Philip was working at Abbott. And he said, well, I'll go talk to my boss, George Rathman. And it turns out George was interested in this idea. And fast forward, George became the first employee of Applied Molecular Genetics and the CEO for the first 10 years of the company. Philip then became one of the earliest employees. He followed George to Amgen. And being one of the earliest employees of a very successful biotech company, he built up a significant amount of wealth. And in 2006, I believe it was, he donated $8 million to UCLA to fund a series of graduate fellowships. Talk about paying it forward. This just, to me, shows how beautifully interconnected the whole ecosystem is. And so, fast forward to, more of the present day. And if you look around, the connections are numerous, extensive, abundant. And, one personal connection is just thinking through, Amgen has drawn on the local environment, the local universities, for many of their senior leaders over the years. David Chang, who went on to greatness at Kite and Allogene, David Reese, who was my boss for a number of years, and myself, coming from Caltech 7 years ago. In addition, some of the most important drugs in our pipeline come from the local biotech ecosystem. Xaluritamig, a partnership with a company started by my former colleague, Steve Mayo at Caltech, Xencor, where we're developing xaluritamig for prostate cancer. LPA siRNA for cardiovascular disease came from a collaboration we had with Arrowhead, which is based out of Pasadena. I have another connection with Philip Whitcomb, and this is how I know him. About 21 years ago, I started a biotech company, Proteolix. And Phil Whitcomb was instrumental. He was our founding CEO. He was our Eminas Gadiz, who helped us actually raise the venture capital. And when we were raising the capital, we were talking about where we would put the company. And it wasn't even a question. It had to be the Bay Area, because that's where the resources were. That's where the laboratory space was. That's where the supporting CROs were. And most importantly, that's where the venture capitalists were. And one thing I learned is venture capitalists don't like getting on airplanes if they can avoid it. And look at what's happened in the past 21 years. We now have a vibrant, growing ecosystem in LA, including our very own venture capitalists. And that has enabled a tremendous flowering of biotech in the LA area. And if you think the progress since the first of these meetings in 2018 has been spectacular, and it has, I have a word for you. We are just getting started. So we are all here because we believe in the future of the LA biotech ecosystem. And I think you will see it on display today. And I hope it knocks your socks off.
Good morning, everyone. I'm Michele, LeSueur. I'm really proud to be here with you today on behalf of Kite. We're honored to be ongoing sponsors for LABEST and really look forward to the sessions today. As I start, I wanted to share a quote with you from Charles Darwin. And Charles Darwin said, "In the long history of humankind, it is those that learn to collaborate and improvise that prevailed." And I share that quote because it reminds me of what we're here to do today: collaborate, improvise, and learn from each other. And it really speaks to me because it is very much the way that we work at Kite. We have been working tirelessly over several years to improvise on the science of cell therapy, and we are singularly focused on this technology. But our mission is what drives us, and that is to bring a curative treatment to cancer patients. And doing this in cell therapy is not an easy task, and certainly had required a lot of innovation from a few of you in the room as well, have helped us deliver these innovative therapies. But it's incredibly bespoke. It takes the T cells from patients and actual cancer patients, and we modify those T cells, re-engineer them to express a specific antigen receptor, and then reinfuse them back into the patient so that those T cells can go and seek and destroy cancer cells. And with that technology, we're really proud of the over 21,300 patients that have been recipients of our treatment. We've done this through 2 commercially available treatments across 5 debilitating indications. And we are reimbursed in over 25 countries across the globe. Kite stands at 4,000 employees strong, and many of those are actually based in our cell therapy manufacturing sites, where we have over 1 million square feet dedicated to cell therapy alone. And while our roots started in the LA area with our headquarters here in Santa Monica, and our manufacturing sites also here close to LAX because we need to reach those patients as soon as we can, we've equally expanded our footprint to the East Coast, not only with our manufacturing facility, which our newest one is located in Frederick, Maryland, but also with the acquisition of Tmunity, a private biotech company that was focused on cell therapies. And we equally have footprints and presence across the globe from London out to Asia. And in these 3 manufacturing facilities that you just saw, between California, Amsterdam, and Maryland, we are incredibly proud of our manufacturing capabilities. We work tirelessly to make sure that they are fully integrated and bespoke and focused on cell therapy. And with that focus, we can go quickly and efficiently from bench to bedside with these really innovative platforms and treatments. And what we're most excited about is with this bespoke patient-by-patient treatment, we can get to patients within 14 days from the time they are leukapheresed to the time that product goes through the engineering process that I shared with you before and QC'd and out the door of Kite. And this has been an incredible accomplishment. We strive every day to reduce that turnaround time because we know these patients cannot wait one more day for treatment. And that predictability and reliability is what you get when you are singularly focused on these innovative treatments. But it doesn't stop with manufacturing, of course, because that is the foundation and something we're incredibly proud of. But our R&D strategy is something that we need to be singularly focused on as well. And we need to collaborate, and we need to improvise, and we need to be thoughtful about how we build upon the foundation that we have in lymphoma and expand to other tumor types, other disease areas, or incorporate other types of platforms other than autologous. And joining me today, I have two colleagues that are in the room with us. Priti Heggie will be speaking. She's our global head of research at Kite, and she'll be sharing more about our R&D strategy on the drug development platform this morning. And Chris McDonald will be joining us to share a little bit more about our technology and manufacturing improvements that we've been focused on at Kite. So please join them in those sessions. An example of us really fortifying our footprint in hematology through R&D partnerships is our partnership and co-promotion and co-collaboration with Arcellx. This is a very strategic partnership that we've engaged in because we recognize there's more that we can do, but there's expertise that resides outside of what we have at Kite. So bringing these two organizations together allows us to deliver and hopefully to commercialize in the near future an innovative and best-in-class multiple myeloma treatment. So I hope in my moments with you today, I've shared with you how Kite is focused on changing the way cancer is treated and how important collaboration and everything that we do, internal collaboration to help us improve our manufacturing efficiencies, external collaboration to help us improve the diversification of our pipeline and reach more patients is core and central to how we work. But we can't do that without the biosciences ecosystem that exists in places like here in LA. So thank you again for having me, and I look forward to the sessions this afternoon.
Thank you, and good morning, everybody. It is a privilege, and I think only right, to follow, among others, my longtime friends Bob Bradway and Ari Beldegren, to tell you about another major player in the ecosystem in the Los Angeles area that is fueling this golden era of medical discovery. That is CIRM, which, for those who aren't familiar, was founded embodying California's frontier spirit back in 2004 through a ballot measure that I'm guessing a number of you probably voted for, which established the agency and authorized $3 billion in state general obligation bond funds to fund grants and loans to academic institutions, research institutions, and biotech companies in California. Headquartered up in South San Francisco, CIRM, since its founding 20 years ago, has put out $3.4 billion. You notice that number is bigger than the three I just mentioned. Well, you probably voted again in 2020 for a measure that re-upped the agency for another $5.5 billion. So at $8.5 billion, we are one of the largest public-private partnerships in the world and have helped enable California to become, without question, the major player in the space of cell and gene therapy research. CIRM has to date funded basic research, translational, and clinical research, as well as putting $250 million, Bob, into education and projects that are very similar to those that you mentioned. We have funded 106 clinical trials, and we have funded many different entities throughout the state. Just to name one arbitrarily, UCLA, we have given 160 grants totaling over $427 million to this institution to cover research spanning from rare disease all the way up to the most prevalent diseases. Very importantly, we have also put a tremendous emphasis on making sure that our products that we help enable will be available to all citizens of California. We are big believers in DEI, big believers in figuring out how to make products accessible and affordable, and indeed are mandated to do so by the proposition that you guys passed in 2020. One very important thing that we're funding is $1.5 billion in the neurological disease space, also mandated by the proposition. And towards that end, we're developing specific strategies for cell and gene therapies in the neurospace. So I had 3 minutes. I think that about uses it up. But I wanted just to make sure everybody understood that we too are very committed to building the ecosystem here in Los Angeles. And as a co-sponsor of this great event, thank you, shout out to my former board colleague, Judy Gasson, former because I'm no longer on the board, which I was previously. Judy, I know you're out there, who is a co-organizer of this tremendous event. Thank you, everybody, and enjoy the day.